If you live in Texas and you're getting ready to come into Medicare, I've got some pretty good news. Texas is actually one of the better areas for cost. And it certainly makes a difference in how much things cost. And Texas, for whatever reason, has some of the lower pricing on stuff like Medicare supplement plans, Plan G, Plan N, stuff you may have heard about by now. But it certainly makes a lot of sense to understand exactly what our costs are going to be when we're coming into Medicare. So I'm Keith Armbrecht. I'm founder of Medicare on Video. I help people across the country make the right Medicare choices. Texas, one of my favorites, and it's probably my #1 state for helping folks with their Medicare. So hopefully you'll allow me to help you as well. That's what we do. We get you set up. We make sure all your pieces are in the right places. We make sure we get the best value for our Medicare. In Texas, again, wonderful from a cost standpoint. So when you come into Medicare, the first big decision you need to make is, are you going to go Medicare Advantage, or are you going to stay with original Medicare Part A, Part B with a Medicare supplement plan? And I will always recommend stay with original Medicare with a Medicare supplement plan. It gives you the flexibility, the freedom, the choice. Really, you have all the control with what's going to happen with your healthcare as you get older. And we certainly know as we get older, we're going to have more healthcare needs. If you choose a Medicare Advantage plan, they are a little more affordable on the front end, but more costly as you use them. And the biggest drawback with a Medicare Advantage plan, it is not Medicare. It takes you out of Medicare, puts you into the plan of a private, for-profit insurance company. And that's one of the last things I want with my healthcare, is a company that is for profit making decisions on my behalf. So whether you go with a Medicare Advantage plan, they have networks of doctors, networks of hospitals. You have to stay within the network for the most part. They do tell you in some plans that they have out-of-network benefits, but you would quickly find out that it's cost prohibitive to use it. You wouldn't use the out-of-network because it would cost so much to do. You would have to stay within network. They also typically have referrals. Going from a primary care to a specialist, you first have to go to the primary, get a referral before you can go to the specialist. It can add weeks to the appointment that you need when you go to a specialist. And then the biggest one is pre-authorization, where you go to the doctor says you need this, but then they say, but wait, we have to get it authorized by the insurance company. They have to approve it, which again is just crazy because it can add another week, 10 days or more to getting the treatment that you need. And then God forbid, they say, no, we don't approve it, which happens more times than it should. And those are the kinds of things I would not want with my healthcare. That's why I would not recommend Medicare Advantage. That's why I don't sell Medicare Advantage. I easily could. I choose not to. Original Medicare with a Medicare supplement plan just makes it the way we want it to be. It does exactly what it's supposed to do. There's no pre-authorization. There's no referrals. There's no networks. You can go to any doctor, any hospital, anywhere in the country, and they're happy to see you because you have original Medicare and they know they're going to get paid what they expect to get paid. So those are absolutely the reasons why I would choose any way I can to stay with original Medicare with a supplement plan. Then when it comes time for the supplement, we need to find the best value, whether it's Plan G, whether it's Plan N, could even be a GHD, a higher deductible plan, depends on how much they cost. That's what we do. We do all the shopping, we do all the thinking. We make it as easy as possible to put you in the best position you can be going into Medicare so that you don't have to worry about it down the road. You don't have surprises. And certainly there's no cost to you to allow me to help you. So hopefully you will allow me to help you. Just visit my website, MedicareOnVideo.com, put in your basic information. We will email you the quote so you can see exactly what it costs. We do not sell your information to anybody. I can promise you, it's my website. You will not receive calls from 15 different insurance agents, which it happens way too often also when you try and do stuff online, that it gets sold to multiple different agencies, and you certainly don't want that either. But you will see transparently, very easily, exactly what the cost is. We're happy to walk you right through it. It doesn't cost you a nickel to allow us to do that. You can give a call also if you'd rather just talk in person. Just call my 800 number and we'll walk you right through it there as well. So I hope you found this helpful. I'm happy to help with all this. We'll make sure we get it done, and then I'll be there for you in the future as well. Just makes a lot of sense to put it to bed nice and easy. Hope you found this helpful. Have a fantastic day.